Hi, my name is Jillian Faulkner. I am with Indiana State University. I am currently enrolled in the LPN to BSN program. This is my first health education project with my Nursing 444 class Community Health. We are targeting diabetic patients in this presentation, specifically those with a higher risk of diabetic foot ulcers. Upon completion of viewing this presentation, the viewer should be able to list 5 specific learning objectives. The viewer should be able to explain 5 risk-reducing techniques. They should be able to state 4 initial signs of a diabetic foot ulcer. They should be able to state 5 factors that influence the health of your skin. The viewer should be able to differentiate between skincare do's and don'ts. And lastly, the viewer should be able to list specific treatment options related to diabetic wounds. At this point in the presentation, I would like to ask that you please take some time to assess your knowledge prior to completing the rest of the presentation. You can do this by simply clicking on the pre-test link in the comment section of the submission. First off, it is of utmost importance to understand what a diabetic wound or foot ulcer is. Diabetic wounds are known as ulcers and are usually found on the bottom of a person's foot. This can be unilateral, meaning on one foot or the other, or bilateral and can occur on both feet at the same time, depending the extent of the disease. Diabetic foot ulcers, abbreviated as DFU, occur due to nerve damage, which is known as neuropathy, and peripheral artery disease, abbreviated PAD. This causes lower extremity ischemia since there is a lack of blood flow to the area. Diabetic peripheral neuropathy is a leading factor in almost 90% of all diabetic foot ulcers. When nerves are damaged, like in neuropathy, the patient is no longer able to sense pain or extreme changes in temperature, which leads to the breakdown of healthy skin and tissue. Unfortunately, this breakdown in healthy tissue invites infection and allows for a breeding ground where the wound can then stem from. Ischemia occurs when blood circulation is limited to one's feet, causing a lack of availability of oxygen, glucose, and critical nutrients, and results in PAD, which increases the risk of a non-healing wound and infection. PAD is 2 to 8 times more common in diabetic patients. Diabetes is a widely known disease, but it is so complicated and so different on a patient-to-patient basis that here are some simple statistics to give an overview of the commonality of what diabetes can do. 34 million Americans are diagnosed with diabetes. Diabetic foot ulcers occur in approximately 15% of those. 6% of those that develop a foot ulcer will end up hospitalized for a related complication. Approximately 73,000 lower limb amputations, which can mean below the knee, above the knee, or at the ankle and foot, are carried out per year in those with diabetes. Diabetes is the #1 cause of foot amputations in the United States. Diabetic foot ulcers are a serious complication of diabetes. There are multiple areas we will be focusing on in this presentation specifically, like risk factors, early signs and symptoms, skincare and its importance, and treatment options. There are several risk factors when it comes to a diabetic foot ulcer forming. Many of these risk factors are modifiable, while some are not. Most of these risk factors can be found in other body system diseases. For diabetic foot ulcers, a main risk factor is uncontrolled diabetes. Being overweight and having a diagnosis of obesity, neuropathy, smoking cigarettes, inappropriate shoe wear, age, excess alcohol use, and high cholesterol. There are 4 stages to a diabetic foot ulcer. It is crucial that when any of these early signs and symptoms are observed, it is reported to your healthcare provider. Early detection of an oncoming foot ulcer can save a patient's foot or limb from being amputated if it can be healed in a timely manner. The early signs and symptoms include a loss of feeling in either one or both feet, which is also known as neuropathy or nerve damage, swelling or warmth surrounding a wound, as this is indicated in infection, redness around a wound, or even fever is indicative of infection as well. Any colored drainage of fluid or having wet socks is important to report. Any occurrence of pain or unfamiliar odor can also mean infection. Skin care is extremely important for our body's overall health. Our skin is the body's largest organ and is comprised of both protective and adaptive properties. It is constantly renewing new cells and shedding old ones. A person's skin serves many functions, which includes the prevention of fluid loss, temperature regulation, or homeostasis. It produces vitamin D, identifies the touch and pain sensations. It can absorb drugs, prevent allergic reactions, and is an external barrier to disease within the body. Many factors can affect the skin's integrity, like age, physical limitations, disease, trauma, nutritional state, and hygiene. As one ages, the natural response of the skin is to become thinner, less elastic, it decreases its barrier to germs, and it is more easily damaged. Multiple conditions like kidney and liver problems, heart conditions, lung disease, and diabetes increases the risk of your skin bruising, drying, splitting, cracking, and peeling, which decreases its integrity and ability to fight infection. This leads to it being more prone to a diabetic foot ulcer. Lack of mobility, such as having a foot ulcer and no longer able to move positions, can easily lead to further skin breakdown. Skincare problems that require attention, especially in diabetics, include the development of a wound, dry and cracked skin, blisters, any drainage of pus, dermatitis, which is inflammation of your skin, and extensive skin tears, as these can all lead to infection because of the natural barrier being compromised. When a patient is diagnosed with diabetes, it is extremely important that they adapt to a new skincare routine. There are a list of multiple do's and don'ts when it comes to adapting to this new routine. What you should do is inspect your skin, especially your feet, every day and observe for any new changes. Use a mild pH balanced soap to cleanse your skin. You should check your bath and shower water by using the inside of your wrist prior to exposing your extremities to hot temperatures. Thoroughly and gently dry any creases and cracks on your feet, paying particular attention to between your toes. Moisturize your skin. Wear soft clothing and avoid any abrasive materials. Use baking soda or an equivalent for moisture control if moistness and perspiration is an issue. What you should not do in any skincare routine is do not disregard any new areas of irritation, as these should be reported promptly. Do not soak your feet in a bathtub for any more than 10 minutes at a time. You should not use hot water, because if you have nerve damage, you will not feel the extent of what the temperature really is, and this can create skin breakdown. Do not apply lotion between the toes or around your nail beds, as this moisture increases the risk for infection. Don't use skincare that contains any alcohol, as it will dry out your skin. And do not apply any tape to any kind of dry, fragile skin. There are multiple treatment options with over-the-counter vitamin and minerals, and which help supplement the body's natural healing mechanism. These should always be discussed with your healthcare provider prior to starting anything new. A multivitamin can help maintain a nutritional balance, and it promotes wound healing. In most cases, you only take one a day. Vitamin A is a nutrient which is needed for new cell growth, and it promotes healthy skin, hair, and wound healing. It can be found in vegetables and fruits like broccoli, carrots, turnip greens, cantaloupe, butter, cheese, eggs, or can be bought as a supplement over the counter. Vitamin C is an antioxidant-rich vitamin which is needed for collagen and helps resist infection. This in turn promotes wound healing and decreases the risk of an old wound reopening due to the collagen. It can be found in things such as broccoli, peppers, Brussels sprouts, strawberries, and citrus-like fruits, or also bought over the counter as a supplement. Zinc is a nutrient which is responsible for cell reproduction, tissue growth and repair, and promotes healing. It can be found in meat, seafood, eggs, milk, and whole grain products, as well as an over-the-counter supplement. Protein is what wound drainage mainly consists of, so it needs replaced to promote healing and nutritional balance. It can be best found in yogurt, cottage cheese, eggs, fish, poultry, dark green leafy vegetables, and soybeans or legumes. You can also purchase these as a over-the-counter drink supplement. Your healthcare provider may send you to a wound care specialist that deals with diabetic foot ulcers when further treatment is needed. The wound specialist may perform something called debridement, which scrapes the infected tissue or dead tissue off of the wound, depending what stage it is at. They do this so that it can promote healing with the growth of new cells and healthy tissue. Antibiotics are also initially prescribed to prevent or treat infection. Offloading pressure is recommended as pressure can break down your skin, and when ulcers are at a certain point, skin breakdown can be detrimental. Tight control of blood glucose is necessity as wounds feed on sugar. Acute infections that are caught early can take as much as 3 to 6 weeks to heal, but chronic wounds and wounds that reopen, along with precipitating factors as discussed, like poor circulation and non-adherence to treatment plans, can take several months to heal, and if the wound does not end up healing, it can end in amputation. At this point in the presentation, I again ask you to pause and take the post-test assessment to see what knowledge you have gained from completing this presentation. The post-test assessment can be found by simply clicking the link in the comment sections, just as you have done before. This flyer gives a lot of great information, including the American Diabetes Association website, which gives tips to pre-diabetes, meal planning, how to maintain skin integrity, and how to manage the disease as a whole. There are many good resources on this one website, as well as on the flyer. Did you know that November is Diabetes Awareness Month? All month it is pushed for diabetes education to understand how it affects your body as a whole. If you would like to print multiple copies of this flyer, please feel free to do so by clicking the link in the comments section.